My name is Max, and today I am going to be showing you Your Medicare Enrollment Center, or Sunfire. This is a tool where you can quote every carrier that's available for Medicare Advantage and prescription drug plans. You can save clients drugs like you used to be able to do on Medicare.gov, and then ultimately you can enroll clients through multiple carriers, all from one spot, whether they be face-to-face or remote sales. So I'm going to log in. And the URL to get here is www.yourmedicaresunfire.com. So all I've done was log in, and this right here is your dashboard. From the dashboard, we can view and work with any of the clients that we've created through here within the past 30 days. After 30 days, they will fall off of your dashboard, but you can still locate all of your clients right here in the search contacts button. And then this is also where you can go to create new clients, leads, or prospects. To the right of that, you have your quote and enroll and send a scope buttons. I refer to this as more of a universal quote or a quick quote. Only time I'll really use this tab is if I'm just checking out a general area or doing market research. So, not necessarily working with one client. And then this right here is just a blank scope of appointment document. So what I do and what I always tell agents to do is go to your search contacts button, create your client. Then after doing so, they'll show up on your dashboard, and I can go over here to this action column. And from there, we can start a quote or send a scope of appointment. And when you do it this way, these will actually be tailored specifically to that client and have all their information pre-populated for you. And lastly, got your reporting, which of course is where you can go to check out any of the applications that you do submit through this tool. So very, very important. The first thing that you want to do when you log in here initially is go down here to the bottom left where you see this gear icon, and you want to go to your profile.
Max, is anyone in the waiting room that you see?
Nope.
No. Okay, cool. Thank you.
Hang on just a second. All right, so now I'm at my profile. You are going to fill out your basic information right here. As far as the social security number goes, if you are writing Anthem, they will need the actual social. If you don't write Anthem, you can just type in 1 through 9 right here. Then below that is a link to your Pearl or personal URL, which is basically your own website like a Medicare.gov where a client can self-enroll. And then by doing so, you're going to get credit for the sale and of course get paid because this will be tied into your NPN. Then you're going to choose your notifications, add your phone number and or phone numbers. Below these right here, you are going to see a button that says add dialer phone for recording. You're going to hit that. It'll ask you to type in the area code of your choosing, and then there'll be another button that says add dialer phone. And then that is going to auto-generate the rest of your virtual phone number for you. So then you can make and receive calls through this platform. Then draw your signature down here with your mouse and hit Save Changes. Also on your profile page, right up here is your RTS report, which is ready to sell. So if you click that button below it that says Generate, this will now show you all of the carriers that you can fully enroll clients in through this platform, as well as every state that you're licensed, appointed, and certified in. All right, that's your profile. Now, I'm going to go to my dashboard, top left icon, looks like a good looking house. And let's say that we have a client we want to enter into this system and start working with. So I'm going to go to search contacts. and then add new contact. Fill out my client's basic information right here. So name, zip, phone number, email, and birthday if you have it. If not, all that's required is just the first and last name. So now all that's entered in, I can hit save, and then this client will just be saved to my dashboard, or save and quote, and it'll take us directly to a quote based on this zip code right here. I'm going to show you a scope of appointment first. So for me, I'll just hit save. After doing so, we now have the ability to add notes to our client profile. So if you'd like to use this like a basic CRM and, keep track of where you're at in the sales process, here's where you can. But also, since we have call recording technology, I'd use this to keep track of my conversations as well. Speaking of conversations, going to go up here, top right, start dialer phone. And now you'll see that I'm available. And take your time with this because the first time that I set my status to available, I got a pop-up on my computer like right around here. And if you're anything like me, I see a pop-up. I don't even read it. I just X out of it. So don't be like me. Take your time. If you get the same thing, just be sure to hit allow. But I'm just going to hit make a call. And then what's nice about this is once I hit call and start recording, you see we have our disclaimer pop up for us right here. And this is huge. So with the new CMS disclaimer requirements, we already have the number of carriers and plans that you represent pre-populated for you. Of course, as long as you are contracted through us, all the math will be correct. So that would save you tons and tons of time, especially if you work multiple states and counties. But now I'm on the phone with my client. I'm going to use this tool right here, last name starts with, to get to my client. And here we go. So action, 3 vertical dots. And now from here, we can view their contact, start their quote. You can send them a direct link to your personal URL to self-enroll, and we have our scope of appointment.
Hey, Max, can you go a little bit more into the personal URL and kind of what that means?
Yes, I will cover everything, and I'll go over that at the end if that's okay with you.
Thank you.
Yep. So I'm going to go to my scope of appointment. And then top right, we have 4 different options as to how we can complete a scope. So because I am actively on the phone with my client, I do get the option for a voice scope. We could email, text, or upload one as well. And I will tell you, if I was not on the phone with my client, I wouldn't get voice scope, but I would get a complete scope option. And then that right there is what you're going to use for your face-to-face situations. So for me, I'm going to go with voice scope. And everything that you see here at the top of the page is going to be the scripting that we're reading off to our client. So first, we got the products that we're going to be going over, and then just please say yes if I have permission to discuss these plans with you today. You got 3 sentences of scripting, and then below that, now we're just filling out a standard SOA. So you have your information, client's information, I'll add their street address and city, and you'll see everything else is pre-populated from their profile. Next up, we're going to enter in our initial method of contact, and just keep in mind you are not going to have a drop down right here. These are just my cookies, so you can type in anything that you'd like. And we have the plans that we're representing. I always tell agents right here, you can either put carrier names or product types. Either one will work just fine. Throw in the date of my appointment. And right here, this is saying, hey, if you're taking the application at the same time as the scope of appointment, why? Then we're going to scroll down past our definitions. And do you make your own healthcare decisions? If it's yes, we're good to go. If it's a no, we just have an additional sentence of scripting. So then we're going to hit save. And we get this pop-up right here. And this is just letting us know that the client has signed the scope. Don't forget that you need to sign it afterwards. Then you're just going to go over here to the right where it says sign and just click that. So click. And now it's signed. And what that just did is it took my signature from my agent profile and then applied that to the scope for me with the click of a button. Piece of cake, right? So now scope is done. I'm going to go back to my dashboard. I'll get to my client by their last name. Action, 3 vertical dots. And now let's start their quote. So here's our quote. You will see this is based on that zip code I had entered in my client's profile. Below that, we have our different product types to choose from, as well as all of our different filters. So at the beginning, I mentioned we can quote every carrier that's available for MA and PDP, but this will default to only showing me the plans that I'm ready to sell with. If you want to show everybody around, just deselect right here. So now, when it comes to us running these very detailed quotes, there's two places we can go. I can go up here, top rightish. If my client is currently on a plan, we can enter that in. We can change their pharmacy, add their medications, doctors, and then how often they go to the doctor. So you can run through all of these individually, or I could go over here, top left, middle icon to my customer profile, and we can complete them all from one spot. So I'm going to go here. And now in this tab, we do have a customer lookup. So you can enter in your client's Medicare number, and what'll happen is it'll verify that Medicare number for you, give you their Part A and B effective dates. It'll let you know if they are on low income subsidy or Medicaid, and then also if they're currently on a plan, it'll pull that for you as well. And then we're going to choose the products we'd like to talk about with our client. I'm going to go with MAPD. And then next, if my client is currently on a plan, I can enter that plan name into my quote and then see if I can save them some money throughout the year if they were to switch plans. So I'll say they're on this Humana choice. And then next, let's add their doctors. So you can go right here and extend that radius if you'd like to. And I'm just going to go over here, throw in my doctor's last name. You can add hospitals or medical groups right here as well. And let me add one more for you. And you'll see you don't got to type the whole thing out. Just start it off and wait for your drop down. Then below that, what we can do here is actually throw in an estimate as far as how often a client will be using these services throughout the year. So if I go with rarely, this is saying maybe clients going to the doctor 5 times a year, occasionally 10, frequently 20. And when I add these, what it'll do is take these numbers for these services, cross-reference them with the individual plans and the copays and co-insurance associated with them. It'll then do the math for me and give us a dollar amount for what will be considered their health cost. And let's add the pharmacy and medications. So you'll see right here in my area, pharmacy defaulted to Walgreens, but if you did want to change that to mail order pharmacy, a local mom and pop shop or say CVS, here's where you can. And let's enter in the drugs. Medication name, Lipitor, primarily because, hey, I can pronounce it. Here at the top is showing you the most common dosage, but then also right here, it's letting us know that there's a generic version available as well. And for the sake of a demonstration, I'm going to add both. So for right now, I'll go with the most common. Someone says, how does the client sign the scope? We went through a voice signature. So the client signed just by saying, yes, I have permission to discuss these plans with you today. So got my most common selected. I'm going to save and add another one. So medication name. Lipitor again. This time, I'm going to go with my generic version. I'll select and then save. So the next, if my client is eligible for low-income subsidy or extra help, here's where we can select that level. And then again, if you do use our customer lookup, this will be selected for you. And then we have our focus questions. So let's say, for instance, this client really wants to keep their same doctors, and then also they would like a plan that has dental, vision, and hearing. So what this is going to do is help better rate the plans that cover everything that I'm saying I want to be covered. And now let's view all plans. Someone says, is there any regulations for adding clients MIB under their client quote? Notes. Absolutely. Yeah. If you want to keep that saved in the notes, that is perfectly fine for you. But here's our quote. The first thing that I want to point out to you is this plan here at the top is the one I said that they are currently on. Above our plan names, we have our sorting as well as our time period. And this is a full 12 months. So if you wanted to change this based on an upcoming effective date, here's where you can. And then by doing so, our estimated annual cost would then reflect the rest of the year out of pocket. And you may ask, well, where in the world did this 7482 come from? Well, right here we got our estimated annual cost summary. This is their drug cost, health cost, and premium, all bundled up and put together for you. Speaking of cost, let's take a look at what we have here. So we have our maximum out of pocket, our deductibles. This is letting us know which additional benefits are covered, if and how many of our drugs are covered, and then whether the pharmacy that I have selected is preferred or standard. Below that, right here, you got your estimated annual drug cost, and this will show you a side-by-side comparison of multiple pharmacies. So the reason I add those two drugs is to segue into this situation right here. One of my two drugs are covered, and I want to know which one is and which one is not. You guys are professionals, so I'm sure you already know, but where you can find that information, just next to my enroll button, details. So first here in bold, it's going to bring you to benefits details. And what's nice about this tab is over here to the left, I have this navigational tool. If I go to plan documents, down here you got your full summary of benefits as well as the entire evidence of coverage and star ratings. But let me get back up here because what I want to show you is drug cost details. And now from here, this is letting me know that my generic atorvastatin is a tier 1 drug, but then that actual Lipitor is not on the formulary. Below that, we can also see how much this client will be paying per month per drug and which stage of the coverage period they'll be in by month. So if this client were to hit gap coverage throughout the year, it would let us know. And let me go back because next we have our compare/email quote. So you can compare and email up to 3 different plans at a time. Down here bottom right, hit compare. And then now you can view these on your end, side by side and line by line. But let me go back because maybe this is a remote sale. You're on the phone with the client. Once again, bottom right, email. And send it off. But just keep in mind, for them to get into this quote, they will need to enter this PIN as well as their birthday. And we will be giving this to them separately. It's not going to be included in the email that we send. So shoot that over to them. And it will tell you when you send those over, each plan will include the full summary of benefits, just like we had seen in our details tab, as well as enroll buttons that are linked to your personal URL. So if you do have a client that can get through a 5-page application on their own, it can definitely save you some legwork. And now let's address our doctors. So this is letting me know both of my doctors are in network with this Aetna plan, and then it's also indicating to us this doctor is in fact the primary care physician. But maybe they don't have one, so we got you covered there as well. Find in network PCP. And then from here, we can filter by gender, extend that radius, or go directly to the carrier's agent portal. And follow me over here to the top left where you see we have our plan X-ray. This is really a much easier way to jump in between if you are jumping between plans if you are shopping around. And it's basically everything that's important that I've just shown you consolidated into one page. So we got our drugs, whether or not they're covered and where they are on the formulary. We got our doctors, whether or not they're in network. Some more plan benefits. Down here, a list of preferred pharmacies in that zip code. And finally, some more specifics when it comes to your dental, vision, and hearing benefits. And let me go back because lastly, with our quote, we already went over the total cost for the Humana plan that they're currently on. Check this out. If I look at my annual cost summary for this Aetna plan, again, this is going to do all of the math for me and let me know that I can save this client a whole $24 a year on their drugs, about $1,400 a year on their health copays. And then between the accumulation of the drugs, the health, and this premium right here, I'll be able to save this client over $1,500 a year if they were to switch plans. Pretty neat, right? And at that point, I always say, I don't know about you, but if you could save me 1,500 bucks, where do I sign? So then we just go to our green enroll button and take a look at this. So just like the scope of appointment, because I am actively on the phone with my client, when I go to hit enroll, this is going to bring me to a telephonic signature or a voice application. So that right there is going to be used, of course, if you have a client that doesn't have email, they're not good with text, not tech savvy, we could take a verbal agreement instead. And of course, all of the scripting is CMS compliant and reviewed by the carriers annually. But let me get out of here and also show you this. So say, for instance, I wasn't on the phone with my client, like I no longer am. Now, when I go to hit enroll, this is going to bring me to a standard application that does not include any scripting. So this one will be used for your face-to-face situations, or if you'd like to fill the application out and then just send it over to your client to sign, either through email or text message. So then from there, they can just type in their name on your computer or device, or theirs if you send it to them, and then it's sent off to the carrier. And then after doing so, you have your opportunity to start your health risk assessment or a value-based enrollment. And now let me go over the personal URL with you. So as I mentioned earlier, if you do have your client saved to your dashboard, you can go over to your action column and then just send them a link to your Pearl directly this way. Or you could do as I'm going to do. I'm going to go to my profile. Here's my Pearl. I'm going to copy that, open up a new tab, paste that puppy in there. And here's your Pearl. So all the client's got to do, type in their zip code, see plans and prices. So first, they're going to get a quick tutorial. And now from here, they have the option to choose between MAPD, MA only, or standalone PDP. And they can do everything on their end that we've just done on our end as the agent. So they could add their own drugs, doctors, change pharmacy, health, etc. And I will tell you, this is only going to show plans that you're ready to sell with. So if a client types in a zip code for, I don't know, Kalamazoo, you're not licensed there, it will show no plans available because I don't want somebody enrolling in a plan through your website if you're not getting paid for it. And let me show you one other thing that's neat. Let me add a drug real quick. And let's add a doctor. Do, 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 do. Go with my same one, continue. And we'll say that they go to the doctor frequently. So now check this out. Now that I've made changes to my quote, you'll see up here, we now get this, the client now gets this personal code. So what's neat is, say they get stuck. They can take this personal code, call you, and what I can do on my end is I can go to quote and enroll right here. I can enter in that personal code, and then I'll hit apply. First thing you'll see, the zip code pre-populates. But then now when I hit view all plans, you're going to see that everything that they've just entered into their quote is now at my fingertips. So I could take what they've done and continue along if they get stuck. Who is the licensed insurance agent? Is that me? Yes, it sure is. Pearl, that is slick. Had no idea about this. Yeah, it's a great thing. I've had agents that, they're rewriting, hundreds of clients during AEP. Sometimes I have agents that will strictly only use the personal URL, but then also I have had agents that, like to keep their finger on the pulse and like to, not use it at all. But now check this out. So here's our quote. So remember, I added that adverb discus right here, and then I said that they go to the doctor frequently. So now everything that they've done is right here in my fingertips. But that, ladies and gentlemen, is everything that you need to know about Your Medicare Enrollment Center. I'm gonna check out this chat and see if there's any questions that I missed. But if you do have anything else, don't be shy. Feel free to type away.
Hey guys, you can go ahead and unmute and ask a question. In the group chat, you can ask a question. So whatever you want to do to ask
Hello,
a
good morning,
question.
guys.
Hey, John.
Hi, yeah, this is John Peterson. Got a question about I guess first one I actually have is about SCPs. And so I don't know if this issue has been fixed yet or not. Oftentimes we'll have SCPs that are active for 6 months, a year or more. And so we got some of those in Texas. We had some in California. The SCP start date, I've noticed that at one point in Sunfire, if we go beyond 60 days, Sunfire won't allow us to use like a disaster SCP, natural disaster SCP. Is that still an issue? Has that been resolved or is it on the radar?
So I've talked to them about this several times, and I mean they've given me several different options and responses. So some of the support team over there has told me like it's a CMS rule that it has to be within X amount of time. But like I know like here in Florida, like we've had like I think it might have just ended, but we've had one that's been like over a year old. So like what I was telling agents to do is just put today's date, and they're saying usually that's fine. But I've asked them about it, haven't really gotten a clear, concise answer about the disaster SEP.
Okay. Yeah, it was my understanding it was like I believe 2 months after the end of the SCP, not the start of the SCP,
Right.
but I could be wrong on that one. Cool.
Yeah, but it was like it was strictly like a 2 month period or window that you had to be in. What was your other
So
question?
I do have another question.
Yeah, I was
Yes, I
gonna
didn't
say,
want
like
to.
I
I
said, you
didn't
had
want to.
two.
I didn't want to hog the mic.
Oh, go
So
ahead, man.
yes, for the healthcare usage cost estimator, you mentioned that can do. We can look at that. We can see the breakdown by drugs and what the premiums might be, what medication costs are.
Mhm.
Now, I didn't think about this before, but let's say there's some people that don't go to the doctor at all. And there's other people that go to the doctor all the time. I know that in Sunfire we can select that, what their usage is for their healthcare plan.
Yep,
I'll
and
be honest, I
you
I kind
you
of
can
ignore that. Does it does
I've
that
heard that
healthcare?
before, but you could, yeah, like a
Yeah,
lot, like you could even just ignore it or just say I don't know.
okay. But does the estimator does it include those things that may come up from other types of usage of their healthcare plan, like you know maybe you're having an X-ray done, maybe you're having this, maybe you're having that. Does it estimate that kind of stuff too?
No, it's just specific to what we have listed.
Okay, okay,
So yeah, there's like no specifics. Like you can only change it from like say like doctor visits 5, 10, or 20. You can't say like 3, 12, and or 9 or anything like that. So yeah, it's just what we have already pre laid out for you.
gotcha. And then on the personal URL, does that work pretty well? Because I know a lot of our clients are seniors, and I'll use my dad as an example. He's like, I don't want to use my computer anymore. I'm retired. I don't care. I just use my phone. Everything I can do on my phone. So how well does how well does everything work on the phone with Sunfire, like a standard iPhone?
It looks a little bit different. It is compressed, but I've done everything A to Z through Sunfire on my cell phone, including call recording, the Pearl, running full quotes, scope of appointments, and applications. I've done it all on my cell phone.
Cool. And I'm sorry, I got quite a few for you here. I feel like a reporter, just kind of going back and forth. Another question on the phone recordings with Sunfire. When we use Sunfire as a platform for recording our calls, does it automatically read any of those disclaimers we're supposed to be reading, like a TPMO disclaimer, or do we do that on our own from our own script?
You're gonna have to do it on your own. It does pop up for you, but
Oh, cool.
we used to have it where it would play the recording for you, but now that they've changed the disclaimer to where you have to
Hmm.
have all these numbers, I mean, there's literally no possible way for my guy to
Right.
record. you know, 1 through a million and then
Right,
put it there for
right,
you. So yeah, now
right.
you just have to read it on your own.
Okay, cool. And I kind of missed a minor detail there earlier. You mentioned that we can send the Pearl to the client, and then I believe they can kind of get started on it. And let's say they kind of give up halfway through, you know, maybe they've entered in their doctor, maybe some medications, and they're not sure what to do after that. Then at that point, I think they can send it back to us. Do they email us for help, or I missed that part on how we can bring up what they've done, like
So what I was
the work
showing
they've done
is
already on that.
once they make a single change to their personal URL in the quote, they get this personal
Hmm.
code right here. And then from
Ah, okay.
there, you can go to quote and enroll, and then you could enter in that personal code to then gather that information.
Okay, okay. Cool, thank you. That's all I got.
Someone says, are HRAs still available to access through Sunfire? Yes, they are. Can you run through an option for text scope? I mean, not really, because there's 30 people on here and you'd be the only one to see it, so no. But it's the exact same thing whether you were to email it. So I could show you email real quick. So yeah, I just fill out the same standard scope of appointment that I'd shown you earlier. And then once we send that over to them, we're gonna get a personal code that we give to them separately. They type in that personal code, and then they just sign simply by typing in their name on their computer or cell phone.
Hi, this is Gary Wright. First of all, I want to say great presentation. I've been using Sunfire for a couple of years, but
Nice.
like a
Hopefully I
lot,
showed you something new.
yeah, like a lot of stuff, you know, there's a lot more power to it than most of us use probably. But anyway, my question is, when you were talking about scope of appointment, and you said, I remember there was a spot where you said, because you know you've got the 48-hour rule now, but I thought I heard you say that there's a spot in there where you can do this application the same day as a scope of appointment, and you just have to explain why. Can you
Right.
can you go into a little detail on that?
Yeah, that's right here. So yeah, so it's not a required field, but yeah, if you are taking the application at the same time as the scope, yeah, this is the field right here where it's asking you why. So of course that would be like for your walk-in scenarios.
Right. So if it's a current client and we're so CMS is good with that. We could actually do that then.
For a walk-in, yes.
Only for walk.
You guys probably know better than me, but like I've heard both. I've heard call-ins were good, and I've heard that they're not good anymore. I've heard yes and no. So you guys probably know better than I do as far as the call-in, but I know walk-ins are okay.
So Holden, what's your opinion on this?
Yeah, if someone's walking in, you don't need a same day scope, or you can do a same day scope instead of the 48-hour rule. Meaning, like if they're walking into your office, or if they're an inbound call instead of an outbound call. So if a
Right,
client is
okay.
calling you to enroll, and then you're enrolling through this platform, you don't need to wait 48 hours to do it.
Right, okay.
Inbound and
So if you make an appointment with somebody, you've got to have the 48 hours still.
Yeah, you'd have to wait 48
Okay.
hours.
I got
Unless you do this, if you do the scope over the phone when you're booking the appointment, let's say it's Monday and you call them and set an appointment, you can do the scope that day. And then once Wednesday comes around, now you're compliant.
Okay, got it. Thank you.
Yeah.
If an agent is a carrier through a different hierarchy, can they be added to the program? You will be able to quote them, but you will not be able to enroll.
I had a question.
Go for it.
When will y'all be displaying the 2024 plans on the system?
10-1 for quoting, 10-15 for enrollments. Great question. So close to that date. I should have brought it up. Thank you.
All right, I'm gonna
Probably
jump
the
in.
most important question.
Yes, for sure. Got another question for you as well on recordings. So typically I've got a platform I use called Ring Central, and so it does recordings pretty easily. And so for that recording, I'll record the entire call per CMS regulations. Now for the voice scope, I can include that as well with my recording platform, or do I need to use the Sunfire recording platform for a voice scope?
For both the voice scope of appointment and application, you need to be on the phone with your client through Sunfire. If you already have your own platform, What you could
Mhm.
do is like have a three-way call or a conference call with your virtual phone number, and then
Right.
that will then allow you the option for the voice signatures.
Okay. Yeah, then I'm on the hook for storing it for 10 years is the only thing I'm sure.
And if you do it through Sunfire, that's our obligation.
Right, right. Thank you.
Hey, Max, so doctors' meds are stored in Sunfire, but the MBI number is not stored in Sunfire. So whenever I create a contact, it looks like if I go back to the contact, that if I've already put the MBI number in, gone through it and then done the quote and enroll, that MBI number now appears to still be in there if I went back to that page. Is that correct?
Unless they just recently changed it, because I tell you this, like I'm support, so I like first, HIPAA rules, like I can't like actually work with like real Medicare numbers, but by design, they initially made it so that you couldn't, that when you went back to your quote, your customer lookup information would be removed because, like plan changes and things like that. So just to keep the information accurate. But what I had brought up to them was when you go to create a contact, like, there is nowhere here to put that Medicare number. So what I had asked them was, if we could add a spot where that is included in here, and then of course that would translate over to the application, basically so that you could create your client right here and then never have to, come back and look up this info again. So it's something that I brought up to them. And I'd say after the busy season, that's something that they would implement just to, save you time. Like, so you don't have to come back here and like look up their address, this, that, and
Yeah.
the other.
Yeah. Maybe in the interim, guys, you could just put it in like email or phone number slot or something like that. So at
Yeah,
least,
somebody brought up a good point earlier, because like once you save your client, you could then add notes to their profile. Let me just show you right here. So yeah, someone brought up a good point earlier, like, is it okay to like put your client's Medicare number right there in the notes? And it absolutely is.
and then how long is that information stored whenever we put the clients, the doctors in? How long is that contact stored in there?
You can't delete it if you wanted to.
Okay, good.
So like if you got a client in there 4 times, you say, hey Max, how do I delete this client? I'm gonna say, sorry, you can't, because if I gave you the ability to delete clients, it's probably gonna cause me more problems than a solution.
Yeah, exactly. Okay. And the scope appointment's stored for 10 years and then it's deleted. It's just stored for the compliant period of time, I'm assuming.
We haven't had Sunfire for 10 years, but just the same as the contact, like if I wanted to go in and delete a scope, I couldn't. So I would assume they're probably just gonna be stored in there indefinitely.
Yeah, perfect. Let's see, is there more questions in
I
here?
got another question too. So
Good.
we went over TPMO disclaimers and how many plans are in the area and that kind of thing. Does Sunfire tell us for all of our, carriers that we're licensed with, does it tell us like a handy number of plans that we support that are in an area, like a plan counter?
It does, but the tricky thing is like you have to be contracted through us. So
Right.
like say for me, like I have like quote unquote have all my contracts here. So this is
Mhm.
gonna be an accurate number. But if you have, I mean, you're an independent, so if you have like if you have different uplines, then in that case, you're gonna have to do the math on your own.
Okay. And does it show us a nice clean number where we can just kind of see it on the screen?
It's right here.
Oh, cool. Yeah, I'm zooming in here. Okay. Oh yeah, it's on that disclaimer. Okay, so when that pops up whenever we're doing the voice scope, it pops up.
Right.
Rock on. That's nice. Thank you.
Yeah, I mean, it's huge. Like we're still like going through everything and making sure that it's 100% accurate and testing it out with agents. But I mean, once we're sure that it is all perfect and up to date and up to par and compliant, like I mean, that's it. I mean, that's huge. That's such. I mean, I'm gonna be screaming that from the rooftops once I know for sure that it's 100% correct.
Awesome. Yeah, clean up that hierarchy, get everything through one upline, get it all in Sunfire.
Yep, and then yep, every state too. I can go to one zip code and it just showed me 10 carriers, 113. I could go to, I don't know, Connecticut or something like that. It'll show me a different number. Like it does all that math for me, especially if you're working different states. I mean, it's huge.
Cool.
I didn't have another question, but I was maybe looking at enhancement, and I know this will be a future enhancement, but is it possible that y'all could extend the search to both the first name and last name? Because if you do a search on just the first name, it won't work. But if you put just the last name, it'll pull up. But it would be nice. Sometimes I'll get to the point where I say, well, I can remember his first name or part of his first name, and then it'll pull up the information.
Yeah, I could do it. And and also like they used to have it, like they just removed this, but like a nice trick that I used to always do is like if I was just looking for a client, I could just leave all of this blank and hit search, and it would pull up every single client that I've ever created. They have confirmed to me that they are going to bring that solution back, so that
Well, I've done that before, and it works if you don't have anything in there and you hit the search unless I took it off.
yeah, they just recently took it off, but they're bringing it back though.
Thank you.
Thank you. For the personal URL when sending to clients, do they already need a client profile created? No, they don't. There is no actual profile. So it's basically just a blank personal URL, and they're just running wild, I guess you could say. But yeah, they don't create a profile yet.
A big thing, guys, with the personal URL too, is especially if you go through WellCare's training, you can see it in there for their annual certification that the personal URL does not need to have the scope, right? They're doing it. It says no, we offer non-agent assisted online application tool where beneficiaries can self-enroll into their desired plan. With this method, no scope of appointment is required unless benefits were discussed beforehand. Broker/agents have the flexibility to market their personalized URL to Medicare beneficiaries via the following: business card, flyer, website, and social media. So there's no scope appointment required for a personalized URL. So if you sat down with a client, oh, I'll think about it and all that stuff, and they're good with technology, get them that PURL and have maybe something printed out, email it to them, right? You can email quote like we were looking at, and there's no scope appointment required. This is something they're doing on their own. So if there was ever a complaint, it's not backlash on the agent. They did it. They enrolled in it. It's them that made this and went through this entire process, right? We provided the information, the detail. If you sat down with them, you do need a scope appointment for that, but not for when they do the enrollment themselves. There's no scope of appointment and there's no issues with complaints. So it's a big factor as well, guys. So really pay attention to that and how to go through it.